Breast augmentation. What is a breast augmentation procedure? Breast augmentation, as the name says, breast augmentation, so increasing the volume. Now, it can be done with various types of methods. The most common is the implant base. So we're actually increasing the volume of breasts using implant. The implants, the different types, the two main types of saline or silicone. So either a silicone filled with a silicone shell, or a silicone shell filled with saline or physiological water. Which one is the right choice for you? It really varies. It depends on your wishes, your preference, your previous experience, and at the same time, your skin texture. Majority of times, if somebody comes in size A or B, I do not suggest using a saline implant because of the rippling effect, because sometimes you can see a bit of waviness. The saline implant are bags filled with physiological water, so amazing implant, but sometimes you can feel the implant. Sometimes you can see a bit of wrinkle on it compared to silicone. It comes in with a thicker shell, comes in with more of a cohesivity, more of a shape. So if somebody is thin, you don't want to see the irregularities of the implant through the skin. Now, if somebody comes in with size C, D, or even higher, using an implant, usually you're covering all that irregularities, differences in the form of the implant by the breast tissue. So in a sense, you're increasing the volume. At the same time, you're really camouflaging or covering the implant enough so you don't get the irregularities. Which volume is the preferred volume for you? This is a very personal choice. It varies depending on your skin type, it varies on your chest width, it varies on the position of your nipple and lower complex. Ideal is to look at your chest. If the chest is a certain diameter and you're putting a big implant with a large diameter, it's going to bother you from the side. On the reverse, if you're having a small implant on a larger size chest, the implant can move too much. So you have to match the implant. Once you match the implant and the volume, then you can go through the exercise of changing the projection. Higher projection means more of a fake look. Lower projection, more of a droopy and less fullness of upper breast. And this is something that we go through in the consultation. So in a consultation, we try different implants, different projections, different volumes, and also we go through the saline and silicone.